with this, I think we'll go to the next session. And I think the next session is by Satish Gupta, Mind and Heart Connection. A very important connection. People talk about it because that is of a huge help in reducing the morbidity and mortality. Ladies and gentlemen, Satish Gupta does not need any introduction. He is the Secretary General for the last 10 years of this conference and a very dedicated, devoted person who published the first Mount Abu trial, very well accepted all over the world. Ladies and gentlemen, I present to you Dr. Satish Gupta. Satish.
Good morning and Om Shanti. So I am presenting to you today Mind-Heart Connection. What is the truth? So before I go on to Mind-Heart Connection, I just want to tell you one case, because just before this session we had clinical vignettes. We had a patient who had, he had a LED block. In 2007, we went for a DS to LED. 2010, there was a LED instant restenosis, and there was a new block in OM1. So he went for a DS to OM1 and LED. And then 2014, the symptoms again reappeared. There was a new block in D1 and OM2. So he underwent bypass surgery on 28th of Feb 2014. So he had Lima to LED, SVG to D1, SVG to OM1, SVG to OM2. The patient is sitting here, right here. And then what happened? 2014, again the symptoms reappeared and TMT became strongly positive just after 3 months. And June 2014, because he had TMT positive, the ST depression was more than 2 millimeter, and the depression lasted more than 7 minutes. He went to US, Houston, and then his Lima to LED was 90 to 100% blocked within 3 months. And there was distal stenosis. SVG to OM1 was 99% blocked, ostial and 90% distal, and SVG to OM2 was also blocked. The patient is very much here, Rajesh Mittal. And then there he underwent in the June 2014 balloon angioplasty to Lima to LED and SVG to OM2 and OM2. All the balloon angioplasty was done. And just after 5 months later, again symptoms reappeared. So he had angioplasties, 3 angioplasties, 1 bypass surgery, and just after bypass surgery he had symptoms again coming up, again angioplasty done at Houston, and then again symptoms reappeared. And see the angiogram of this patient. See the grafts, all the grafts blocking, Lima to LED blocking. So that is what mind-heart connection means. Can you stand up, please? Come in front. He is from Rohtak. And then he came to us. And when he came to us, he was class 3 to class 4 symptomatic. He was consuming 10 tablets of sorbitate a day. For little walking, he required tablets. And just within 7 days, he was able to walk 2 kilometers. And now, after 3-4 months of using this program, Mount Abu Open Heart Trial Program, or we call it 3-dimensional heart care program, he is asymptomatic now. Kaise Rajesh? Now he walks, he runs, he does all his work. Another patient, similar patient, who had undergone angioplasty, then bypass surgery, and then again symptoms came back. Just within 1 year, symptoms came back. And another patient, I just tell you, Ajay Trivedi, he has diffuse disease in all the 3 vessels. He's an industrialist, 44-year-old. See all the vessels are diffusely diseased, not amenable for bypass surgery angioplasty. In Indians, the disease is diffuse and not amenable for angioplasty and bypass surgery. In at least 54% Indians do not have the vessels which are amenable for angioplasty bypass surgery, as compared to only 21% in the West. So what is mind and what is brain? What is heart? So mind and brain are different. Mind is software and brain is hardware. Brain is physical. It has got 100 billion neurons, higher brain and lower brain, we all are aware, and mind has got 4 aspects. We call it team, thoughts, emotions, attitudes, and memories. And what is heart? There's a physical heart and there's a subtle heart. Physical heart is, we know that what it is, and subtle heart is non-physical. It is software. Anything happening to that heart leads to problem in this heart, physical heart. we call it conscience or consciousness. Today evening I'll be discussing in detail about it, what is consciousness and conscience, and what mind-body relationship. Whenever we have negative team, that is negative mind, every thought or emotion is converted in the hypothalamus in the neuropeptides. These are synthesized for every thought. There's a neuropeptide. They are like biochemical messengers from the brain. They go to each cell of the body, and they release stress hormones, and there is sympathetic overactivity. And that leads to fight or flight response, feeling of dis-ease, sadness, lack of energy. On the other hand, if you have positive team, the positive thoughts, they act on not only the brain, but also the cells of the body. There's a release of endorphins, the strongest inner morphine, which is produced by the body, enkephalins, and there's parasympathetic overactivity, and there's a feeling of well-being, happiness, healing, pooling of energy. So we are born with one target organ system. One of the organs from very birth is weak. It's a manufacturing defect in the body, in the bomb. And then that negative team, which keeps on bombarding it, because we develop habits, we develop personality traits, thinking patterns are wrong, and that's why we develop heart disease or asthma or rheumatoid arthritis, or for that matter diabetes or a kidney problem. And then I just see this video clip for 2 minutes. See, this is the hypothalamus, and these are the neurons. There are 100 billion neurons. And for every thought, every emotion, the endothelium, this hypothalamus makes neuropeptides, which go through the blood circulation to the cells, and they travel to the cells, and every cell has receptors for these neuropeptides. These neuropeptides are there for every emotion, every thought. And within a second, they go to each and every cell of the body, and then these are the neuropeptides, and they go through the blood, and these are the cells. Every cell has a receptor for this. You can see these are the receptors, and there is a lock and key mechanism. For every receptor, there is a lock and key mechanism. It goes and fits into that receptor, and then cell acts accordingly. This locks, and then cell acts accordingly. See this? It has come. Now cell starts, depending on what type of emotion you have, happy emotion or a negative emotion. Same emotion can be good for someone, and same can be bad for. Like for this lady, it is bad. She has some negative experiences. So when she feels bad in this emotion, and the other are enjoying. So cells dances. When you are dancing, cells are also dancing, and when you are in pain, cells are also in pain. See this? That is how the whole system, each cell is having 100,000 reactions in 1 second. And when you have pain or anger or stress, then more reactions occur in a cell. And when you are not happy, then see what is happening to the cells. Cells talk to each other and hit each other also. And this person, his chemical need is not met, so he is eating. Why we eat? The most common cause of obesity is stress. It is not the weight of the body, but it is weight of the mind which leads to heart attacks and atherosclerosis. And see this lady, sauce, spilling on the clothes. What is the effect? You're complaining, right? So that is what happens. That is how the mind, every thought and emotion has a role to play in the body. Yeah? Cells are also crying, right? So that is what mind-body connection is. That is what mind-heart connection is. And they're complaining, right? This is what is happening to the cells. Same thing happens to the cells of the heart also, endothelium also. Yeah. So basically, when you're talking about mind-heart connections, there are two main basic pathways. One is psycho-immunohumoral, that is, and the other one is psycho-behavioral. And if you see here, I think this is a little clustered slide. The psychosocial stressors like type A behavior, anger, hostility, depression, and that has effect on the PNI and PNE pathways. So there's an effect on the autonomic nervous system. So increased sympathetic nervous system activity and decreased parasympathetic nervous system activity. And on the hormonal system, increased CRF and decreased ACTH. And the immune system, there is chronic inflammatory response, and thereby the heart rate variability reduces, the blood pressure variability, low frequency by blood pressure variability reduces, and that leads to strokes and deaths, and baroreflex sensitivity also decreases, and that leads to more cardiac mortality. On the other hand, if you have the hormonal system, there's there's increased corticotropin and increased cortisol levels, which leads to vasoconstriction, and you know how the metabolic syndrome is produced. Immune system, that means leading to endothelial dysfunction, and that is what leads to rapid progression of atherosclerosis and coronary thrombosis, myocardial ischemia and coronary events. And also psycho-behavioral pathways, because of this, they are called health damaging behaviors like wrong diet, lack of physical activity, smoking, alcohol abuse, and poor adherence to treatment regimens. People do not change, people change the doctors. And they have correlated acute psychological stressors, they have the myocardial infarction. What is the prevalence of like anger? Just by anger, within next 2 hours, you have 9 times more chances of developing a heart attack. In the myos, 2.3 times, the upper limit and the 95% confidence intervals are there. Similarly, emotional upset, depressed mood, severe depressed mood, 5.808 times, tension 2.2 times, sadness, frustration, and work stress as high as 6 times more MI. And then the anxiety and bereavement 21 times more, right? So these are different studies have told us. And then what is happening? Acute MI, psychological stress, statics, anxiety, depression, anger, hostility. In short, autonomic activation, increase, same thing, hemodynamic, vasoconstriction, and hemostatics, increased platelet activity, increased platelet aggregation, increased fibrinogen, increased plasma viscosity, increased platelet endothelins. So acute ischemia and thrombosis, that triggers acute MI. So basically, what is the how we get this positive team or negative team, which decides the heart attack or rapid progression of atherosclerosis. So if you become truth conscious or reality conscious, then you will automatically have positive team. If you are false conscious or unreal conscious, I'm so and so, I'm my body, I'm a role, I'm a doctor, I'm very experienced, I'm a rich person, then this leads to negative team, right? And natural history CAD, you are all aware, there is a psychic phase. In the psychic phase, there is excessive and repeated psychic trauma, there is a lack of love, insecurity, isolation, anger, hostility, fear, job stress, and family stress comes in. Then CNS becomes hyperactive, your person feels irritable, hyperactive, mild tremors in limbs and insomnia, and this person looks worried. What is happening in the endocrinological level? Acetylcholine is increasing, catecholamine levels are decreasing, but nothing is happening at the endothelium. Psychosomatic phase, when then it comes to the body, if same situation persists for days and months and years, then functional disturbance start happening. The epinephrine level go up, norepinephrine levels go up, cortisol levels go up, and there's increase in blood sugar, increase in heart rate, increase in blood pressure. So first time you come to know that you are having diabetes or hypertension. And then somatic phase comes in, then there's a role of hereditary background and the environmental factors. Whatever is happening, the negative mind is this, like genes are like seeds, and the negative mind is the like soil for those genes to take root. If a positive team, then even if there are genes, gene expression does not take place. Gene expression takes place only when you have negative team. And environmental factors like wrong diet, wrong exercise, lack of sleep, and smoking or alcohol use, that triggers the disease, and that is how we develop the disease. And then we have the plaques happening, and patient comes to us only in the organic phase. then we just do angioplasty or bypass surgery. That is not the way to treat heart patients. That is not the way to treat atherosclerosis. That is not the way to treat epidemic of coronary artery disease, or for that matter, any risk factor of coronary artery disease. So basically, I just shift this slide. So our mind is like a ocean where these all negative agitations, they're just like waves on the sea. If you go deeper in the ocean of mind, there's a peace, love, and happiness. And ultimately, when you go still deeper, then you'll find bliss and consciousness of the self. And so any disease can be reversed. We have, over the last 18 years, I have seen that any disease can be reversed by reversing the mental pattern. If you have negative mental pattern, that is dis-ease. The dis-ease comes first to the mind, then comes to the body. So first you need mental cleansing, that is through meditation, and physical cleansing is done through diet and exercise. Proper diet, healthy exercise, and healthy sleep, and avoidance of tobacco and smoke. And then what is incurable? Incurable word, it does not really mean it is not curable. It means the person who had coined this term, he had a hidden meaning inside. It means it cannot be cured by outer methods like medicine or surgery. To effect healing or cure, it is in plus curable. That is, it is curable if you go in. It does, and in means you realize the being, that I am a soul. It does not matter how long we had negative patterns or illness or a rotten relationship or self-hatred, we can begin to make a change today. And so what we are choosing to think and say this moment decides our future. So to be willing to change your thoughts and words and watch your life change, the way to control your life is to control your choice of thoughts and words. And consistent thinking patterns leads to experiences. Whatever disease comes to us is because of our thinking patterns. Even we have documented that each block in the LAD, proximal, ostial, or mid or distal, is because of a definite thought pattern. And the patients who modify these thought patterns, they get rid of the blocks. And person who does not modify the block continue to stay or they progress, right? So even RCA or LCX, any part of the artery can be documented for a definite thought pattern. So if you have negative thinking pattern, you have negative experience and disease comes in, and then you learn that positive thinking pattern by consistent practice, then you can get health. So basically practical model, this is the model which we have we have done this research, Mount Abu open heart trial. This has been published, as you know, all are aware. And this trial has been, till now for last 3 years is number 1 in top 20 studies in the world in this category. And this study is a multidisciplinary research project. And Mount Abu open heart trial, in which we had 306 lesions analyzed, and there was an average reduction of 6.2% in mean diameter stenosis. And people who adhered to this program more than 80%, 60%, the regression was 18.88%. And medium adherence was minus, that is regression of 10.74%. And the least adherence, there was no regression observed. And the events also were significantly reduced. So we decided that we have to have at least 50% adherence to this program, only then we can open the blocks or we can regress the events. And this is Abu Healthy Heart Trial, which is going to be published very soon. There's 2 groups, healthy lifestyle group and a control group. And the difference is only meditation. Diet and exercise remains the same. And angiography was repeated after 1 year. And all the angiograms were coded. And then the independent panel of angiographers analyzed the study. And the statistics were also analyzed by the independent statistician. And see this, our 80% patients had either DVD or triple vessel disease, advanced disease. And 93% patients could open their blocks as compared to only 13% in the control group. And average reduction was 12%. And see the angiograms. There's 80% block here. You can see there, it's better there. 80% block opened up. A long diffuse block opened up. A 100% block. We had 33 blocks which are 100%, and we did not consider them for analysis. But to our surprise, 19 100% blocks had also opened up. 100% block opening up, multiple blocks opening up, 80 and 90% block opening up. And the ejection fraction, 30%. After he had two episodes of myocardial infarction, and in the repeat angiogram, you can regenerate myocardium. There are cardiac progenitor cells available, and through meditation you can regenerate that myocardium as well. 80% block opening up, another block 20% opening up, sorry, and 20% becoming 50%, and 100% block opening up. And control group, you see, all the blocks have gone up in spite of diet and exercise. When the same patient was subjected to this Rajoga meditation and diet and exercise modification, these blocks opened up. Because each block represents the, sorry, each block represents a typical thought pattern. See the block, and another block, another 100% block, it is there, and see it is opening up. So what I mean to say is you can modify the psychological factor, these stresses with this lifestyle, type A behavior, anxiety, depression, anger, whatever, and the people can stop smoking and this thing. You can see there's a patient sitting here, Gyan Singh. He was a afim addict, morphine addict, and he can stop it in a day. He was a smoker, he used to take alcohol. He just coming on here and he never took that afim after coming here. And so just the EEG, just can I have it? Just another minute. Huh? The EEG, day 1 and day 7. See how the alpha effect has, alpha rhythm has come, theta rhythm has come just within 7 days of practicing meditation. And the heart rate variability, this is the alpha, and I'll just show you the heart rate variability. How on day 1 and day 7, sympathetic activity has come down and parasympathetic activity has increased. And after 1 year, there's complete harmony between the two. And hormones, all the stress hormones and happy hormones, the stress hormones decrease, cortisol levels decrease, epinephrine levels decrease, and the serotonin and endorphin levels increase. And these are cortisol 8 a.m. and 4 p.m. samples. And insulin sensitivity improves within a week. You can see there's a 13% reduction in insulin levels. And the clinical events markedly improve, ejection fraction improves, and the bad cholesterol decreases, good cholesterol improves, triglyceride decrease, and the events 9 versus 38, odds ratio of 11. So that is the take-home messages. First is spiritual care, that is 3-dimensional health care. Be natural, be self-conscious, not body or role conscious. Remember that I am a being, I am a peaceful being, loveful being, happy being. And for that, practice meditation in the morning. And mental care, I'll tell you in the evening, mysteries of mind. Why it is important to remain in silence up to 8 a.m. and then eat natural. So what Dr. Joshi told us, it is not only eating what to eat, but when to eat and how to eat. That is important. And be in the lap of nature, have morning walk with sunrise. Daily walking is a must, and have proper sleep. Sleeping is very important. Early to bed, early to rise, and proper use of medicines. And if angioplasty or bypass is required, go for it, but that's not the solution. And that's it. Om Shanti. Thanks for nice listening.
This was a very erudite and a very learned talk, and I think I'm sure we all learned a lot from your, and also the animations were really great. I think they bring the point home regarding the mind-body relationship actually in this patient. I think we really need to stress the one paper that he had, which was published, how long ago was that?
Mount Abu Open Heart Trial.
Yeah, right. That was really very interesting.
It's given to everyone in the file. Yeah. That paper is there in everyone's file.
I think that really clearly shows regression of atherosclerosis there, and I think I was privileged to be associated with that study. But I also want to point out that, coronary angiogram is really very limited in looking at atherosclerotic lesions because it really does not give you can't, it's not a luminogram, it's luminogram.
Yeah, I know it is.
But really you can't see
it
that.
Is limitations, but that's right. But other factors which are there, right. The events.
Yeah. And I think what we need to do is in the future is to look at some of the
IVUS,
like intravascular ultrasound.
IVUS
and
required.
Use that because then you can look at atherosclerosis.
We are planning a next study with that
right.
IVUS. Yeah.
And atherosclerosis is a very generalized process with many facets to that. And I think one has to look at not only coronary arteries, but maybe you can look at something which is easily to look at.
CIMT. Like we have started another study with CIMT.
Right, like
and insulin resistance.
Right, intermedial thicknesses and something like that. That would be. That may be even better in the future because that kind of relates to what you see in the coronary arteries, which is going to be more invasive to do that.
Yes.
One can look at something very easy to see in a non-invasive manner.
Sorry for the interruption, Mr. Chairman. We have totally run out of time for the discussion on this paper. We'd like to thank Dr. Gupta and other speaker, Dr. Patankar. I request our chairpersons to please step forward. We have the presentation of citations to our speakers. I request Dr. Gupta to kindly stay on, and he'll be joined by Dr. Patankar from Mumbai. I'd request Dr. Patankar to please join. We don't seem to have Professor Shashank Joshi around. Okay, his citation and plaque would be presented to him in due course. I'd request the chairpersons, Professor Nanda, Professor Levy, and the other chairpersons to kindly join. Dr. Nitin Patarkar from Mumbai. Thank you very much, Dr. Patankar, for being here with us and sharing your thoughts. And for the mind-body connection, Dr. Satish Gupta, the organizing secretary of this Congress.